Barnhill, Paul Delcott, Clay Chesser, Danny Clark,
Here.
Todd Collins, Steve Giannakis.
Here.
Jim Herrick,
Here.
Dusty Jordan,
Here.
Ron Mayberry, Ricky Murray,
Here.
Keith Nash, Devin Pickard,
Here.
Ron Puckett,
Here.
Wayne Thomason, 8 present.
8 present, we got it. Quorum, y'all should have a copy of the agenda in your packet. Look for a motion to approve. Got a motion by Commissioner Jordan, second by Commissioner Herron. Any discussion? All in favor say aye.
Aye.
Opposed? Ayes have it. First up is the public comment period. Is there any on it?
No.
No public comment. And then first up is Mr. Kersey with medical insurance. And y'all should have in front of you a piece of paper here.
Thank you very much. Appreciate the opportunity to address you like every year. I'll try to get over here so you don't have to turn
Well,
around.
I'll sit right over here.
Okay,
Turn
all
so
right,
you're
very good.
And Devin allowed me to.
Come on.
So I can see absolutely well.
You might have to beat Ron.
Look at that guy, CD.
He's gonna beat you to it. So what you have in front of you, Commissioner, is a copy of what we would propose for next year. But before we get into that, I want to kind of talk about what informs our thought process as we look at that. So as a reminder, our firm, Benefits Inc., helps broker your insurance products. We, just so you know, we service about 2,000 group clients under management, basically in the lower 48. So everything from two-person mom and pops up to our largest employer has 4,000 or 5,000 employees. So we do this in a lot of different regulatory markets. So as a reminder, insurance is regulated at the state level. So wherever we are, we're kind of playing by a different set of rules, right? So, but we do a lot of municipality business and a lot of county government business across the state of Tennessee. Just like we've managed this plan for you all for years now. It pre-existed my relationship with Benefits Inc. But a couple of years ago, 3 years ago in fact, you made a very important switch, which was you moved from a fully insured insurance contract to a self-insurance contract. Anybody who's been watching the news or has seen anything, for the last several years, what you know about medical insurance specifically is that it goes up and up every single year. It's getting more expensive to deliver care. The American healthcare system, while it's, pretty amazing at some of the things we can do with these advanced pharmaceuticals and other things, folks are living longer, but it comes with a cost, right? And so groups are dealing with that across the country. That's not unique to Hickman County. But what you all did to try to keep that cost from rising just exponentially every single year, you were used to those 20%, 25% renewal increases from Blue Cross. We would go to Cigna, we would go to United Healthcare, we would try to quote it and get them down. But you knew annually that renewal was coming up. So what we did 3 years ago was we put ourselves, i.e. Hickman County, in the driver's seat. So you are self-insured now. And so we are now just funding claims. So every year there's not a renewal. In the old days I would call Crystal and Candy and I would say, okay, I just got the renewal from Blue Cross. They're starting out at 32% over current. We're going to quote it with everybody else. Now it doesn't work that way. Now we're just paying claims. And so whatever you consume in a year is what it costs you to run your health plan. And then our job as your broker is to try to look at that data and identify cost centers. What are some things that are costing us way more than we would normally expect under a plan of this size, for example? Or what are some areas where we're kind of stubbing our toe when we don't need to be, right? And so as we look at this, we kind of zoom out and we really start thinking more about the law of large numbers, right? So if you show me 1,000 people, a group of 1,000 people off the street, I can tell you that they're probably going to perform in statistically predictable ways. Out of those 1,000 people, X percent of them are going to have heart disease, X percent of them are going to have diabetes, those kinds of things, right? So the more data we have, the more predictable your plan performance becomes. And so to talk about, first I want to look backwards and then we're going to look forward, okay? So if we look at the last 12 months and I pull your large claimant report, right now because you're self-insured, what we do is we go out and we buy a stop-loss policy. And that's $100,000 and that's on each individual person that's on the county plan. And so that includes your employees and that also includes dependents. And that's called your specific deductible, okay? That's the only insurance that you buy now. Everything else is just claims. What does it cost to fund the employees going to the doctor, having babies, you know, all the things, right? So we go out and we purchase that $100,000 stop loss. So if any one claim or any group of claims in what's called the aggregate hit that stop loss amount, that stop loss insurance kicks in and pays so that they don't deplete the county's other funds that they've set aside to pay health claims, right? You wouldn't want one person, I'm gonna use an extreme example, you wouldn't want one person with $10 million in health care costs, which would be really hard to do, obviously, to deplete the county's claims funding balance. So that's why that stop loss exists. You could increase that to 150,000 or 200,000, you could lower it to 50,000, but where it's been and where we like it is kind of a sweet spot is right at $100,000. So if I look at your claims over the last 12 months, you experienced $1.853 million in claims that were over the $100,000 stop loss. So that stop loss is doing its job, right? It's kicking in and it's paying that to protect you from that liability. Now, if somebody's got over $100,000 in claims, they have a condition, they've had maybe a cancer diagnosis, they could be a premature birth, could be a lot of things, right? But the point is, if somebody gets to that level of spending, it's not because they're seeing an out-of-network physician or they accidentally went to this doctor instead of that doctor, right? So for those pool of folks, we need to take care of those folks because they're sick and that's what the insurance is for, right? So rather than looking at that pool, what we try to do is say, okay, what's happening in the rest of the claims activity that could help us? Let's not spend dollars loosely or accidentally because we know we've got to preserve dollars for these higher claimants, right? So of your claims last year, 43.26% of them, that's a pretty specific number, were over that $100,000 stop loss. So that left you to pay out $2.43 million in claims that were below that $100,000 stop loss. So those actually do hit your claims funding account. Everything else is paid by the reinsurance. And then the one renewal I do still get, so remember I told you I don't get that Blue Cross renewal and say, okay, Candy, it's going up this amount, or Crystal, it's going up this amount. We get a renewal on your stop loss, but that stop loss is a tiny component. That's what's called your fixed cost. Everything else is just claims funding. So this year, your stop loss did take an adjustment because of that hit, but now, because we're getting more longevity, the underwriter can say, okay, we anticipate we're gonna have this claim year in, year out. We know this person, we know they're on the plan, or we know this group of folks are gonna hit that, so they can adjust their pricing so that it can stay more level over time, okay? But the other things that we looked at was we said, all right, if we can't do anything about, again, a $100,000 claim, you really can't prevent. That's somebody with a chronic diagnosis or cancer or something like that. So the question is, are there things inside our current plan design that may encourage more expensive behaviors, right? So the first thing that's obvious is a $250 deductible. That's something that you all have maintained for years. It's a very generous health plan. After that, it pays 80% of the cost. The employee pays 20% of the cost until they hit their out-of-pocket maximum. Knowing that we wanted to preserve that, one of the things that we talked about this year was, what if we looked at doing a dual option? And so the page that you have in front of you shows where we're recommending that you go, which is we're now creating a base plan, which is of lower value than your current plan, but it is also of lower cost than your current plan. And then your option 2 plan is the exact same plan that you have now for the exact same price. So for any employees who say, look, I like my plan, I want to keep my plan, they can choose option 2, and they will continue paying $50 per month for that coverage, or $25 a pay period, just like they have been. So nothing would change about option 2, with one small exception, which I'll talk about here in a minute, but I don't want to break stride between the two options. So option 1 is the exact same network. Nobody's got to change doctors, nobody's got to change pharmacists, nobody's got to change hospitals, any of that. What we've done is we've simply implemented a $1,000 deductible. So under option 1, if you choose that, you'll notice for employee only, it's free. So we're saying you don't have to pay that $25 a pay period or $50 a month for it. It's free. Why are we doing that? Well, because we want to give them an option. We also know this is a transition year, so we don't want to pull the rug out from under anybody. We want them to be able to have the exact same plan they have now for the exact same price. But by offering them this option at no cost, but it includes that $1,000 deductible. What happens after you hit the $1,000 deductible? Well, then the county kicks in just like it does now with an 80% co-insurance. So we cover 80% of the cost. You would pay 20% of the cost after you'd hit that deductible until you, as the employee, hit a $3,000 out-of-pocket maximum for the year. If you got to that point, you would be fully insured after that. The county would pay those claims until the stop loss kicked in, if that's what happened, and then the reinsurance carrier would pay those claims. So until I've hit my individual deductible of $1,000, once that happens, then everything's going to be covered at 80%. So if I go to the doctor, to a primary care physician, and that bill is going to be $100, I'm going to pay $20. The plan's going to pay $80, for example. Okay, so it works just like your current plan does, but instead of having a $250 deductible, it's going to have a $1,000 deductible. By doing that, we anticipate, and this is the underwriter's guess. You never know until you actually go through enrollment. But we think about 50% of the current employees will say, I like free a whole lot better than I like paying for something, and I'm willing to take that trade-off, right? So if you've not been to the doctor in the last 6 or 9 months or year and a half, you may wind up getting that $1,000 deductible back. You know, if you're 25 and just started working for the county and you're not raising a family and having children, that sort of thing, this may be a really good option for you. Or maybe you're older, but you just don't have a lot of health claims, hadn't been to the doctor in a while, right? So option one could be a good way to save some money there. But it also helps shift some of that risk off of the county. Right now, with that $250 deductible, what it means is that basically you're on the hook for any and every claim, because it's not hard to hit a $250 deductible. The other thing that we looked at was, and it's really convenient to have, certainly not saying anything bad about it, but it's really convenient to have that freestanding ER over in East Hickman. In fact, HCA is talking about putting another one of those in Fairview. So you'll have 2 that are pretty closely situated to where a lot of your employees live. The problem is, as soon as that ER came online several years ago, we were able to see in the claims data where folks were starting to use that as a walk-in clinic. That's very, very expensive, right? So when you have a $250 deductible, and again, I'm not saying anybody does this with malice in their heart, they're making a rational decision. If once you've hit your deductible, you're not having any expenses, it's very convenient to go to a freestanding ER. You don't have to make an appointment. You don't have to talk to your primary care physician. If your kid's got a sniffle, you can take them in there, get them checked out, and get them back to school before they've really missed first period, right? The problem is, any ER claim, because of the nature of what they do, is astronomically more expensive. You may have a $10,000 cold and flu visit that would have been $100 at your primary care physician, because the ER, it just costs that much to go to an ER, because they've got everything there in case you're walking in the door with who knows what kind of an emergency, right? So one of the things that we've done here is in option 1, we've put a $150 copay on an ER visit, just to try to remind folks, hey, it basically triggers in that brain, is this really an emergency, or can I go to my primary care physician? But it's not so astronomically high that it's gonna hammer folks, right? And then in option 2, which is your current option, this is where I said there is one small change, but I didn't want to break stride, is going to be that there's a $100 copay on ER visits, even on option 2, which is the plan that everybody has now. So, and the way that would work is it would apply to the deductible first, and then you would still owe the copay. So, once you've hit that $1,000 deductible, we still don't want to encourage folks, if it's a non-emergent situation, to go to that ER. We want them to use their primary care physician. We looked at the data, and it looks to be about 64 claims last year. We can identify it pretty easily because of the codes that are used by the doctors there. About 64 claims, or what translated to be about $100,000 in claim spending, were for non-emergent codes in an emergency room setting. So we're not just guessing. We can use the data from your self-funded plan to inform where we go from here. Before, when we're fully insured, we're just groping around in the dark, honestly, because you don't have access to any of that data. So that's a very high-level overview. Thank you. I know that was kind of like watching grass grow sometimes, but I wanted to sort of let you know that you've done some really smart things. Number one, you've gone self-funded. What that does is that puts a lot of people who are even smarter than me getting eyes on your claims and doing analysis and saying, okay, where are these cost centers? Things like pharmacy, things like ER claims, so on and so forth. So what we wanna do this year is add this dual option. We wanna see how that performs, and then when I come back to you next year, we'll have even more data to say, okay, this worked, we should do more of it. This didn't seem to have as big of an impact, and so maybe we'll look at making some of these other changes. But with that, I'd be happy to take any questions that you have.
Miami, go ahead.
Matthew, I meant Michael, I'm sorry.
So,
The drugs, didn't something change on that for the preventative?
yes, so under both plans, right now you have a prescription drug copay for preventive drugs, which is a $10 generic, $35 name brand, and then a $60 non-preferred. We put that exact same card on option one, but because the deductibles are so different, in real life it's gonna work out very differently. So on your current plan, you probably don't notice much of a difference between a preventive medication and a non-preventive drug list medication. Because once you hit that $250 deductible, even if it's not on the preventive list, the county's paying 80% of it, you're just paying 20. So you may not notice that big of a difference between the two drugs. On this new option, on this base option, which again, doesn't cost you anything, so there's, in exchange, you're gonna pay a little more cost, is that if you're on that preventive RX, you'll still pay $10 generic, $35 name brand, or $60 non-preferred. But if it's not on the list, you've gotta satisfy that $1,000 deductible first, and then the county's gonna pay 80% of the cost after that, which still is a very generous plan, but it will make a large difference, which is why we anticipate that this will help suppress claims. I mean, this is, you're to the point to where if we don't start to put in some other less rich options, this is really gonna start eroding other parts of the budget, just to be quite frank about it.
And also, we added the tiers, so that would,
Yes.
could help the claims.
Yeah, another thing you'll notice here, you've always had just an employee only or a family rate. So if you're a single employee, you don't need coverage on a spouse or any dependents, you would pay that rate. Past that, you just paid the family rate. What most groups have gone to over the last several years is a 4-tier rating system. And so the idea is that children, typically, statistically speaking, should be less expensive to insure. They don't have chronic illnesses that adults have and that sort of thing. So you'll see there's a tier for employee plus spouse. There's a tier for employee plus any number of children. So if I work for the county and I have 4 children, but my spouse has coverage elsewhere, or I don't have a spouse, whatever, I would fall into that employee plus child rate. So that's employee plus any number of children. And then family is simply 2 adults, any number of children. But that way we can kind of parse that out. You know, when we looked at the tiers, there were some folks who were probably paying a little more. They just had employee spouse, but they were paying the full family rate. So we wanted to kind of acknowledge that. And the other thing is if you got a single parent or somebody like that, they're getting a little bit of a discount as opposed to having to pay that full family rate. They're just paying that employee plus child. Thank you. I meant to cover both of those points and I forgot. Any other questions about this? Okay, Blue Cross, just to remind you guys, we talked about this at the last two years as we've gotten into this, but now that you're self-insured, you also get to share in some of the things like pharmacy rebates and other things. Blue Cross is increasing those rebate reimbursements back to the county. That is baked into these cost projections. But just so you know, your plan is running the way we designed it to. Now we've just got to look at, okay, what are some things that we can do to contain costs in some hot areas?
Commissioner Nash.
So Michael, this is probably as much a conversation for these ladies as it is for you, or maybe more for these ladies. You know, we kind of been plugging along with the plan, kind of like it has been, and you know, we haven't changed premiums in the last bunch of years as far as what the employees see, but we've obviously had to put more money into the kitty. So, you know, when you look at how much we budgeted last year and where we are at in the current fiscal year, did the amount of money that we put in last year, was it sufficient to get us through this fiscal year?
We are running really close. If we get by, we're gonna barely get by.
Okay, so what you're saying is you did a great job of budgeting. Okay. So, having said that, so we know that, you know, whatever that exposure was, we've got it, had it covered this year. So the changes that Michael is talking about, that you guys are talking about, you know, what's, I mean, I know this is very smoke and mirror. I mean, we don't know until you do it. I mean, you know, but you gotta look at this as, like you said, you saw some of those behaviors that you're trying to curtail. So if you, obviously what we wanna do is we wanna curtail those to the point where it reduces the amount that we're putting in that bucket. So, having said all this, even, and with this in here like it is, what's y'all's thoughts about the bucket for this year? I mean, that's the part that we have to deal with, so.
And we've been talking about that all
Yeah.
afternoon.
Yeah.
I mean, is Michael gonna offset, I mean, I know he did such a great job of offsetting some of that with a check last year.
Yeah.
That's right.
So, if you'll stroke us another check,
There you go.
Michael, we'll be all right, no, so.
Do you want me to speak to the underwriter's
Yeah.
projection, or?
Yeah, that's fine.
Okay, all right. So again, please don't write this number down and then subtract it from exactly what, you know, because as you pointed out, it's not an exact
No.
science. But the underwriter's back of the envelope projection of just offering this dual option, they thought you would see about a $500,000 reduction in claims. Then if we add to that what we're doing on the ER copay, again, some folks are still gonna just go to the ER because that's what they do, and they're gonna pay $150 for the privilege or $100 for the privilege, depending on which plan they're on. But for anybody that was kind of hitting that as a convenience item, you know, if we can knock that out, again, there's about $100,000 in non-emergent codes. So those two together, $600,000, is that an exact number? Absolutely not. You know, we want to see how this does. The other thing, as you pointed out, and again, this is a multi-year discussion. You know, you can't turn a big ship that fast. But you're right, you haven't raised premiums on the employees in several years. And so when we look at the cost or the impact of these changes, it didn't move the needle nearly as much as it would have as if we said, okay, now all of a sudden the employee's got to pay $100 a month, or, you know, because that is a part of that claims funding as well, right? Now that you're self-insured, you just got to come up with the claims dollars, however you come up with them, and it comes from employee premiums, it comes from their deductibles, and then it comes from everything that you're willing to pay on top of that.
So, and I'm having this dual conversation here. With the changes that you're looking at, the tiers, the two options, all those things, realizing that under the old system, we came in, you know, again, if we hit the budget, we hit the budget. That's what we're here for. So, I mean, would you guys look at this next fiscal year putting in the same amount? You're still gonna go up?
Yeah, because the fixed cost went up,
Yeah.
due to the stop loss and the high claims.
So what kind of percentage are y'all looking at?
We originally thought it could be up to 3.4, but what we did was, what we looked at today, the fixed cost went up about $350,000. And if you base that on the claims that we're barely making now, that's about 3.1 is what we would be asking for. There's 2.9 in there now, so it would raise the current budget that we projected.
200,000.
Yeah, about 174,000.
With hopes that the
Yeah,
changes
no,
that
no,
we're making.
I understand. I mean, okay. I don't know who, you can't, I mean, I'll pick up a rock and throw it at Michael. But other than that, I mean, I have a hard time seeing where we have a lot to fuss about, if that's what we're talking about. I mean, I understand there's a lot of moving parts in this, but ultimately, if that works, and that works, okay.
Page 18 though, it says 10% increase in mine.
We were, that was before we had the
Okay,
the
gotcha.
data, we were
Oh.
just guessing.
So we've already
Yeah.
chop chop. Like it.
And speaking to those fixed costs increasing, it's hard, I know because you're not looking at this chart, there's some personally identifiable information on here, which is why we don't distribute this out to everybody, but, you know, you've got 8 members that constitute that 1.85 million in claims. And that's, again, there's nothing you can do about that, those folks, they're high claimants. And so that's what's driving that fixed cost increase, that 350 that she's talking about. But again, if you're fully insured, instead of taking that increase just on the stop loss, you take it globally on all the premium, right? So the idea is that in every 6 years, you have 2 bad ones and 4 good ones. So the idea is that while the fixed cost may go up, if your claims then level out over the next 2 years, you start to get some of that money back.
Michael, is there any, with the 4-tier system, is there any possibility that some employees might take, their spouse may take their, you know, wherever their spouse has insurance, is that a potential benefit as well?
It absolutely is. This is not something y'all have ever done, but just so you know the possibilities, you can absolutely say, and many companies do, if your spouse is offered coverage, you can't take this coverage. You know, they've got to take the coverage that's offered to them as an employee of their employer. Again, that's not something that you all say now, but the 4-tier rate could help with that as well. If they say, well, actually I can get it at work cheaper because they pay 100% for employee only, it may also take away some of those claims as well.
So would we, you haven't made the adjustment,
I have not, wanted y'all to hear the presentation, but we're recommending 3.1.
3.1%.
And we're, you know, it could be more, but we're hoping with the changes we've made, it will be.
Oh, 3.1 million. 3.1, I'm sorry.
Yeah.
Oh, so that's an increase, I'm sorry, I thought we were cutting.
No. Do y'all want me to go ahead and make the change, or?
I think based off of what we just heard, it might make sense, right? See where we're at.
But see, now that's not what we really discussed a minute ago. I guess that's where I'm getting confused. 'Cause I thought we were at 2.9 last year, then we're going to go to 3.1.
No, 2.9 is what I had estimated in the budget worksheet that I gave you last time. We were at 2.6 last time. That's a 17%.
And so, but you think that we're gonna be hitting close to 2.6?
That's where we were hitting this year.
I know, I
Yeah,
understand.
Yeah, and we're hoping the claims will go down. We're using last year's claims plus the increase is what we're doing for the fixed cost. Saying that, it will be about 3.1.
That's not nearly as attractive as what I had envisioned in our conversation long ago. So, again, we're gonna hit 2.6 this year. We're offering these other flexible options, and you're still looking at this coming in at 3.1 now.
Yes.
That's not as good as I would have liked.
16% increase.
Yeah, yeah. What's the national, Michael, what's the average?
Well,
When you start looking at, you know, not being, I mean, just, let's not talk about cost. Let's
Yeah.
just talk about rate of increase year over year.
yeah, this year's been especially bad. I was telling Crystal before I came in here, I've got another group, about y'all's size, that renews the same time. They're still fully insured with Blue Cross, but they're big enough now, I get large claims reports. They're in a pretty similar health position as you all are. They're taking a 49% fully insured increase this year. So they're asking me now to take them self-funded just like I did. And I would say that's not unusual. I've got 60% renewals on my desk. I've got 45% renewals on my desk. This year's has been particularly bad because there were a lot of federal changes. There's just less money swimming around the system, and so reimbursements rates change. Provider groups have to charge insurance companies more to be in their networks, and there's just this reshuffling that's going on.
So, I mean, yeah, I mean, and again, I'm just looking at the numbers, so, I mean, if we, actual in 2024, 25, we're at 2.3 million. Then we hit 2.6, and again, you guys think we're gonna come close to hit the 2.6. This is on a stronger, increased trajectory than the majority of our expenditures.
Sure.
And we are making these changes also.
Now, question, on the solid waste, we have, a line for insurance as well.
Yes.
That's not in the 3.1, right?
No, their claims are running low enough that I think that they are okay.
Okay.
But we did not reduce it because one bad claim for them can
Yeah.
really throw them.
Okay. So, and then is the highway department, I haven't looked at through there.
They're okay as well.
Okay.
Yeah.
But total, if we were to, and I'm just curious, like, our medical insurance, if we, cause you have different buckets of, you know, I mean, what is it, what is the total that we're budgeting for medical insurance alone? If
I
we had,
didn't look at that today. I think we budgeted around 900,000 for highway department. Solid waste,
I've got the numbers
Oh, do you?
here, but I don't know if these are the same as your revenue
Okay.
numbers, but all in, the projection was about 4.439 across all departments. And that's another great point, which is, in the past, the highway would run hot, the county would run better, vice versa, right? We've split all those buckets out now, so we know for sure that one is not subsidizing the other. And just so you know, the highway department made what was a difficult choice for them once we went self-insured, which was take that retiree population and move them to a Medicare Advantage plan. As a result of that, their claims are under control, right? And so now, this dual option is kind of the county's first step to try to start turning that ship as well. So when we change things, it does have an impact, but we also know that there's real lives involved, and so we want to make them incrementally, you know, you're turning a big boat, not a small boat, so.
also, does this, potentially kind of pave the way of some high deductible, whatever, HD, HP?
Or an HSA?
Well, like HSA, like I have an HSA, and I have a high deductible, my deductible is like $7,000.
Right. That could be a third option that we want to add in the future. You know, the state plan has a high deductible health plan paired with an HSA. Especially younger employees, they love that. You know, my wife and I started participating in HSA before I was ever married. I was probably 21, 22, my first job. I kind of set a payroll deferral into that, honestly forgot about it. You know, 5-6 years goes by. Now I'm married. I've still got my HSA. We paid for the delivery of our first 2 children out of money that I had saved in my early 20s that I honestly forgot was in there, you know, because it was just coming out a little bit each paycheck. So for folks who understand and see the value in that, that's huge. The state plan added a high deductible HDHP health plan a couple of years ago, and I mean, folks swear by it, right?
Yeah.
But if it's right for you, it's right for you. The premium projection on that, because you know you're talking about then a $5,000 deductible or you know something much higher, the premium projection on that would be rock bottom, right? Because the employees they're taking on that liability themselves.
So, any other questions for Michael or, well, we got them? All right. Well, we appreciate your time, appreciate you coming and explaining some things to us.
Sure. Thank you.
We may have some questions after the fact.
Understood. Yeah, anytime we're easy to reach, and then like I said, we're not just going to make these changes and put a blindfold on. I mean, we'll be looking at that performance then, you know, quarterly, see how things are going, and then continue to make recommendations in the future.
And I'm thinking 3 years ago, we were up around 40 or 50%, I think was the increase. that
Correct.
we were
Those fully
facing.
insured renewals, we're going from bad to worse, that's right. And we also got into a point, because of those high claimants that we talked about, where other carriers were saying, hey, if Blue Cross wants you, they can have you. So we were also running out of other markets to go to, so. Yeah, this is the most efficient way to do it, because you're not paying anybody else a profit to run it, right? I mean, you're the insurance company at this point.
All right,
Thank you.
thank you. All right, now's up is, on the agenda is a work session. So, any, budgets that we would like to go through or try to discuss tonight?
I've got a question, and Crystal may have done it, I just haven't noticed it. Can you work your magic and budget as presented?
Show you where we're at. I can, before we do that, on the revenue code 44131 for the smokeless tobacco, when we were going over it, something sounded wrong last week, and I got to looking at that. I think that 95 needs to move up to 160,000. And are you okay if I go ahead and make that change?
That's revenue.
Yes, we're increasing the revenue.
Yeah, we like increasing revenue.
Can you work some more magic?
And I suspect because it's a sheriff, I mean, that's anticipated, like, I mean, that would be,
That'd be pretty close to that.
But it could be a little bit more, but we were trying to be conservative because it's our first year.
sure. So right now, gonna explain where we're at.
Okay, so, we're projecting a $5.6 million beginning fund balance with the current budget as is. It's at $3,176,417. So we're hitting the fund balance for a 2.4 million.
And that's at the 170. We're looking at the deficit of 45.4 cents. That's at the 170,
Oh, I haven't updated that, I'm sorry. I don't think that formula is completely right.
gotcha. Oh, right.
Well, that's one question.
28.79 cent shortfall. So that's at the tax rate of 171.51 would go to whatever, add 28 cents to it, just shy of $2. All right.
Well, that'll make me sleep better tonight. I mean, that's 28, too many numbers in my head right now, that's $85,000 pennies.
Yes.
That's right.
Can you sell some more cigarettes?
Well, we sold some beer. Just kidding. Just kidding.
We did.
Yeah, I know. All right. particular fund that we want to, and that's fund with a D, fund we wanna go into or look at or discuss?
I think the easy one is nonprofit.
The nonprofits? That's in the very front part, of your book. The 32nd, the Child Advocacy Center, they didn't ask for any, is there any, what, are we not, did they just go away? What's the,
I haven't heard anything from them.
okay,
I was surprised that they didn't present, 'cause they usually always do.
yeah. I'd be open for any motions or discussions.
I think last year, we, discussed, I think Commissioner Nash was the one who brought it up, the motion was made that if it doesn't do the community or the county as a whole, benefit the whole county, then we should not fund it, and that, one of them's in my district, but the two community centers, we're taking them back to zero. That motion.
Got a motion by Commissioner Jordan to remove the two requests for the community centers. Is there a second? Got a second by Commissioner Barnhill. Any discussion?
What's the motion?
To remove the two community center, the 10,000 requests of each. Any discussion on it? That would reduce it 20,000 there. Not, let's do a roll call vote. You got the motion, you gotta do with that? Okay.
Matthew Barnhill,
Yes.
Danny Clark,
Yes.
Steve Giannakis.
Yes.
Jim Herron,
Yes.
Dusty Jordan,
Yes.
Ron Mayberry,
Yes.
Ricky Murray,
Yes.
Keith Nash,
Yes.
Devin Pickard.
Yes.
Ron Puckett,
Yes.
10 yes.
10 yes, motion carries.
Hey, would you take that?
Commissioner Nash.
Now, I've had a conversation with several of you in here. If you look at the county's growth, year over year, the county grew at about 3%. That's what we did. And so, you know, I believe that government needs to, you know, not outpace what we have there in the world. So having said that, I mean, and this is, you know, my thoughts. You know, the Fire Association, we gave them 156 last year, 3%, of 156, a 3% increase will take that to 160,680. I make a motion that number becomes 160,680.
A motion by Commissioner Nash, second by Commissioner Herron, to adjust the Fire Association to 160,680. Any discussion? If not, roll call vote.
Matthew Barnhill,
Yes.
Danny Clark,
Yes.
Steve Giannakis.
Yes.
Jim Herron,
Yes.
Dusty Jordan,
Yes.
Ron Mayberry.
Yes.
Ricky Murray.
Yes.
Keith Nash.
Yes.
Devin Pickard.
Yes.
Ron Puckett,
Yes.
10 yes.
10 yes, motion carries. adjust that or what?
Take it about 40.
Brings that bottom number down to the 22.3 pennies. 22.93, sorry. Still, 2 mil deficit going into the fund balance. Any other discussion on nonprofits that we wanna discuss tonight? All right. Where would we like to jump to next?
Man, I'm really trying to take a lesser role in this budget since I'm gonna be gone in a minute. But it doesn't seem like we've got any volunteers to be boisterous.
You're good at it, Dan.
Well, what are you gonna do next year, is my question. Let's pull up Pete's, and let's get the low-hanging fruit while we're doing this.
All right. Let's go to, 101, down to page,
It's 54410.
Page 14.
14. That was in total, that was if you flip on over to page 15, that's a $201,000 increase in civil defense.
Some of that's changed, cause there was he
Okay.
had typed in 36,000 and it was
Oh.
3,600,
Yep,
so
yep,
it
you're
went down
right.
to 168.
So, just, yeah. I think the request, we could discuss first is the, moving a full-time ops manager. Seems like that would be a good point to start discussing. I believe if I remember Pete's speech was in regards to that they would move from, other salaries and wages, I think, up to a full-time position there.
So, can I?
Yeah.
Okay. So, the full-time that he has now used to be paid from the 189, and he was moving her up to 106, and the two positions in the 189 are two new positions. He wants to make her the deputy and then bring in another operations manager and a planner.
What does the operation manager planner do besides?
I think currently she's the operations manager, but, I can't speak to her job duties, that would be Pete.
Commissioner Nash?
So, first off, my side note is, I'm echoing what my Commissioner Clark said earlier. But, having said that, what does the budget look like if it's at 3%, no new people?
I've got the totals, I can change those if you want. Sorry, I'm writing down the old ones so that I can put them back. Do you want me to leave her in the 106 and just give her the 3% or?
No, it doesn't bother me as long as it's 3%, no new people.
Okay.
You can call them Bugs Bunny, as far as I'm concerned.
And the part-time
no new people. Alright, and is that, go, what's the percentage of increase?
Yep.
A little more than 10.
A little over the 10. Well,
Yeah, 12%.
Got motor vehicle there, that's good too.
well, I mean, I almost wanna sit there, I mean, in my opinion, this was so kinda wacky to begin with, excuse my language, but now that we've curtailed that, I'd almost send this budget back to EMA and say, okay, right now you're at 12, you're gonna have to make it 4. And then he's gonna have to go and figure out how to make that work. So, I mean, I don't know, you know, where that may be, but again, the county grew at 3%. These departments that are growing at rates in excess of that, I think we have to, that's what will always get us in trouble. So.
Hang on. Sorry, I didn't see that overtime, so it brings it down just a little bit more.
Crystal, would you mind just putting the formula over it and column L and just do a percent and see? Eight point
It needs to be more or less.
Well, I mean, yeah, it's up to this body, I mean, across the county, we grew this business called Hickman County on the revenue side, so to speak, at 3%. And so, but the way we don't make up a budget shortfall is to grow at a rate on the revenue side and double that rate of growth on the expenditure side. That's not how you fix a budget, in my opinion. So.
Well, I'll go with your recommendation, sending it back to EMA to bring it down forward from 8, cut that.
And I mean, and it does, I mean, I'm not trying to interrupt you, I promise. But I mean, I think that we have to look at, all of these county budgets have sat there and said, we're gonna come in at 3% on our employee raises. Correct me if I'm wrong, we've always kind of looked at the state, okay? The state is only budgeting 2.6% increase, not 3. So we're already being a little more benevolent than what we have had in the past. So, in my opinion, before we start and say, everybody's gonna go back to 2.6, on the employee side, on the salary side, let's set a target for these folks, 3.5% maybe, something, and send these budgets back and say, okay, you can keep your 3% salary, but your overall budget increase has to be X. And let's put those folks back to work to bring that into Q. And while we're on this, just so that we have these numbers in our head, hey, Crystal, do you mind looking at sales tax? And I haven't looked at any of these numbers, at all. Danny? I haven't looked at any of these numbers at all, so it may be, who knows what we're gonna end up with.
That's on page 1 if you,
All right, so that, we've got, you throw it in there at 2.3, right? Okay, so where are we, what's the last month?
That I have would be March.
Okay, so could you run actual March and give us
Yeah,
something?
right now, for March, we have 1,643,985.24.
All right, I'm sorry. That's 9 months? Okay. Give it to me one more time, I apologize.
1,643,985.24.
All right. One more time.
1,643,985.
Okay.
our estimate's pretty good. I mean, if we're at 2.1, I mean,
Okay.
that's.
No, So, yeah, that's gonna be 2.3 spot, okay. Alright. But again, if you look at that 2.3, you see that we're actually making some strides on sales tax. Sales tax is exceeding property tax increases because the customer, I mean, every Amazon truck, every FedEx truck is the same as if you went to Walmart in Hickman County. Everybody needs to understand that. And that's where we're seeing these huge, that's why that number continues to have a more of a steeper climb than the property tax. And so, I just wanted to know that for my own sake, so. I apologize, Dusty, I didn't mean to interrupt you.
And I had Crystal pull some sales tax numbers for the last 5 years, and that is about the same trend. That's about 8% increase, and that's about what we've been trending over the last 4 or 5 years.
As opposed to appreciation of property and what we're gonna call the traditional real growth, that's growing at a rate that's, I mean, it's another clip. Thank goodness. So.
Commissioner Jordan, did you want to finish what you were saying?
I don't know, you interrupt me, go ahead. What was I saying, Keith?
What you were saying was that we should set a base and send this back to the.
Okay, well, you interrupted me to say a lesser number out there. What, it's up to this body, going back to, we need to go back to individual departments, we need to set what we want to set it at, rather than an arbitrary 4 point, or it needs to be closer to a real number that makes sense, And there may be extenuating circumstances. Our sheriff said a whole lot of insurance and food, so, there are circumstances.
Commissioner Puckett first.
I was gonna say, to send it back to the departments that are over, that was saying, not everybody, but just the ones that are over.
Right.
I'm gonna take up for the sheriff. I mean, I think I ran these numbers the other night, let me make sure, and I think I even wrote them down. I think he's like 3.7%. I think the sheriff's department, now I'm talking on the patrol side, is, yeah, 3.7 versus the original. I didn't do now the jail is a different story, it is 8.1%. So, yeah. And the judge left, so he can't help us tonight, so get rid of some people.
I'm thinking the trustee, I know they had a circumstance with a bond situation, so I don't know that we would want to.
No, we have to do that bond.
That's a whole lot in a small budget that she'd have to. I think more, yeah, it was 15 grand. So, Commissioner Jordan, are you making a motion to,
So we set a number is three, what number we set? 3, 4?
3 for salaries, 4% overall, right? That's what I think I heard.
Right, keep it 3% and send it back, any over, bring it forward. Now, I know, like I said, there will be, like his jail side's going, there are circumstances we cannot avoid that, so we gotta take that into account when it comes back to us.
We got a motion by Commissioner Jordan, is there a second? Second by Commissioner Mayberry, any discussion?
I'm having trouble hearing. I didn't bring my hearing aid, I'm having trouble hearing. You got an extra one?
Now, just got one.
Let me, 3% on, salaries, 4% overall, unless there's some kind of extenuating circumstance situation within the budget, which some of them did call out. Send it back to the department heads, offending departments, not all, but if you've offended that, then you get it back.
Well, like the sheriff, his budget involves gasoline. The Chevron didn't hold itself to 3%. We get that. I hope we're smart enough and have done this long enough that we can see through that. It's just that it's growing at 3%, we don't need a 10% wish list, in this. That's just my thinking.
That's the caveat with the extenuating circumstances.
My point is, I agree with what Dusty said.
Nobody objects, let Alan speak real quick.
So we're opening up the new station and we'll have pretty extensive contracted services additions to ours that'll kind of blow that out of the water.
I think that includes the extenuating circumstances. I think everybody up here understands that there's a new building that's getting opened and there's gonna be some either one-time or whatever expenses that might, recurring expenses that might occur. Any other discussion about the motion that's on the floor? I got a question, who's gonna communicate that?
When will they get it back to us?
Crystal and the mayor,
When do we get it back?
When will they get it back to us?
and then when would they get it back?
I don't, I mean, we can try to have it by Thursday.
Let's make that as a goal. I think that's a beautiful goal. We're all gonna be back in this room Thursday. So,
Is somebody gonna point out to the school system that we grew at 3%?
I've had some discussions with a fairly new school board member about that. Any other discussion about the motions on the floor? Roll call vote.
Ron Puckett,
Yes.
Matthew Barnhill,
Yes.
Danny Clark,
Yes.
Steve Gianakis.
Yes.
Jim Harron,
Yes.
Dusty Jordan,
Yes.
Ron Mayberry.
Yes.
Ricky Murray.
Yes.
Keith Nash.
Yes.
Devin Pickard.
Yes.
10 yes.
10 yes, motion carries. Well, we'll put 101 to the side for right now. Does anybody want to talk about another fund that? Let's look at 122. It's an easier. Commissioner Nash.
I'll make a motion that we approve 122, 125, and 127 as presented.
The motion on the floor, Commissioner Nash, I got a second by Commissioner Puckett. Any discussion? On the adequate, I got a question, on the adequate facilities tax, where are we in comparison in surrounding counties and that sort of thing?
On what we charge,
Right.
I could go out in the truck and get it, and did a little research on that with the Director of Planning and Zoning. Cheatham County has a nice one, it's $7,500 plus 50 cents a foot.
I think last time I saw, we were probably lower than most counties around us.
Some of them around us are impact fees, and they're a little bit, that's a little bit different animal. But from what I remember a few months ago, Dusty's right, we're way below what several of them are.
I do know, I'm sorry.
Well, our permit fees were way below the impact fees being as much. And I talked to Austin about, he said the permit fees definitely go up. By resolution. The impact fees, he said, could go up some, but the permit fees were way low.
Permit fees are way low versus, would that be something that we you would discuss in the budget, or is that something in the zoning and planning would discuss? That's what I was thinking. Commissioner Nash?
It's real, typically it's a pretty poor job to try to change a rule inside the budget. The budget just needs to reflect the rule.
Okay.
And I would like to withdraw I'd like to amend my motion that
Okay.
we approve of 122 and 127 as presented, and then we'll take up 125 after.
Okay. Got to withdraw then a motion, or an amendment to the motion to change it to 122 and 127, and second by Commissioner Barnhill. Any discussion on the amendment to the motion? All in favor say aye.
Aye.
Opposed? Ayes have it. So now the amended motion is for 122 and 127. Commissioner Nash, did you have something? Okay, sorry. Any other discussion on that? If not, let's roll call vote.
Keith Nash,
Yes.
Devin Pickard,
Yes.
Ron Puckett,
Yes.
Matthew Barnhill,
Yes.
Danny Clark,
Yes.
Steve Giannakis.
Yes.
Jim Herron,
Yes.
Dusty Jordan,
Yes.
Ron Mayberry.
Yes.
Ricky Murray.
Yes.
10 yes.
10 yes, motion carries. 122 and 127 is approved. Commissioner Nash.
On 125, which is the adequate facilities tax, again, I think that we do need to address that, but this is really not the place to do that, but we should do it. But I would like to make a motion that we do a $400,000 transfer out this year again, like we did in previous years, and for that transfer out to go into 151. This is something that if you've been around here a while, you know, playing catch up on adequate facilities tax, the steps that we have to do in order how to utilize that can sometimes be a challenge. So it's just a whole lot easier if we just take a systematic amount from adequate facilities tax and stick it over in 151 on an annual basis right now. It just doesn't make any sense not to do that. So I'm gonna make a motion that we do a transfer out on 125 of 400,000, consistent with what we did last year, and that transfer would end up landing in 151.
I got a motion by Commissioner Nash, second by Commissioner Barnhill, for 125 to adjust it for the 400K going to 151. And is that, and to approve 125 as well with that
Yes.
adjustment? Okay. And to approve 125. Any discussion? Roll call vote.
Who seconded?
Say it. Yeah, sorry.
Ricky Murray,
Yeah.
Keith Nash,
Yes.
Devin Pickard,
Yes.
Ron Puckett,
Yes.
Matthew Barnhill.
Yes.
Danny Clark,
Yes.
Steve Giannakis.
Yes.
Jim Herron,
Yes.
Dusty Jordan,
Yes.
Ron Mayberry.
Yes.
10 yes.
10 yes, motion carries. Commissioner Nash.
And so now with that 400,000 transfer into 151, I make a motion that we approve 151.
Got a motion by Commissioner Nash, second by Commissioner Jordan for 151 with the 400K added in. Any discussion? Roll call vote.
Ron Mayberry,
Yes.
Ricky Murray,
Yes.
Keith Nash,
Yes.
Devin Pickard.
Yes.
Ron Puckett,
Yes.
Matthew Barnhill.
Yes.
Danny Clark,
Yes.
Steve Giannakis.
Yes.
Jim Herron,
Yes.
Dusty Jordan.
Yes.
10 yes.
10 yes, motion carries.
All the bunny rabbits are out of my hat.
Well, 207, I think is gonna be discussed in the committee, so. Any other work that we wanna do tonight with the budget? Crystal, you're all caught up, right?
what we're seeing there though in that estimated line is that with the current pennies, is that correct? Okay. So, I mean, I guess everybody needs to think about where do you want that, fund balance
Yeah, about 4 million, right?
to hang at, yeah.
If we get it up to 4 million.
I'll take more.
But I mean, to Matthew's point though, he's absolutely right. I mean, about 4 is where we should be at, and if we can get, you know, after these guys come back and massage all this, then we need to go back and look at it.
Any other discussion? If not, there's another motion that can be made.
Motion to adjourn.
Got a motion by Commissioner Jordan, second by Commissioner Carnhill, all in favor say aye. Ayes have it.
Be back